Hi, it's Dr. Greg Jantz, founder of the Center, A Place of Hope. And as we look at the topic of trauma, and one of my most recent titles is Triumph Over Trauma. And I do believe there is healing and recovery from difficult and horrific trauma. I don't say that lightly. The last 40 years, we have specialized in helping people walk through, work through, and have healing and recovery from all sorts of trauma. I want to talk about trauma-informed mindfulness. Mindfulness is kind of an odd word to describe really an intention, to be intentionality, but really what we're saying here, a mindfulness. We could also insert the word meditation. We could insert the word prayer. But we want to be mindful and sensitive to trauma of all sorts and to trauma survivors, first and foremost. We want to set up a environment that's safe and supportive in order for a person with significant trauma to have a level of safety, self-awareness, and self-exploration that's safe in order to move towards what are my action steps to recover in the whole person from trauma. Whole person. Trauma affects me spiritually, my relationships, my worldview, my health, my immune system, my thinking, and so you can see it's a whole person that we must address when we're dealing with trauma. So traditional mindfulness can be triggering. What are we saying here? Body awareness and stillness. Okay, so that can be a part of meditative prayerfulness, mindfulness, whichever word fits. But when we're still and we're aware of our body, for somebody who's had sexual trauma, this can intensify traumatic memories. So this is why we really do need to carefully and know what we're doing here. Emotional flashbacks as well and strong memory flashbacks can occur, like if we settle down and we become in a quiet state to even address our thinking or feelings. Flashbacks can surprise us and occur at those times. Here's a couple core principles in what we're talking about. Core principles of trauma-informed mindfulness. We always want to create a super environment of safety. It's a safe place to practice mindfulness. It's a safe place to explore the overwhelming feelings. It's a safe place to also look, and this is the environment we need to create. You cannot work on trauma and be mindful of it in an environment where you don't trust the person with you. So if you don't trust the therapist, the team working with you, the environment that you're in, it really can set up for really those flashbacks and triggers for extreme flashbacks sometimes. We know that one of the things that is important in working with trauma is let a person have a choice of what feels safe, and a sense of that they're in control. This is so important because through trauma, they may have felt totally out of control. So we can teach what we call grounding or anchoring skills. There are exercises that can be taught to help keep a person grounded. In other words, where I don't feel like I'm totally losing it, I can come back to a grounded space. And we use some skills in DBT, dialectical behavioral therapy. That's just one of the things in the toolbox that we can teach. We also know that breath and breathing, you notice that when you feel intense trauma, it's usually shallow and fast breathing. And when a person is able to feel safe, they're able to breathe slow, more calming breaths. We also know that there's a skill that's taught about where you're feeling things and called body scanning. This may not even be recommended if you've been a victim of sexual abuse. You know the trauma and the memories that seem like they're deeply embedded. And so what we want to do again is trauma-informed, trauma-skilled therapist, counselor team is so important. We can inadvertently create triggers and things that don't feel safe. All right. I always believe, this is my bottom line, that when there's trauma, and this is why I wrote the book, Triumph Over Trauma, because I have a belief after 40 years of working with people that people do recover from trauma. I know that this requires skilled hands, skilled therapists, skilled team, and we must address the whole person. And there's so many things to address in trauma, from how to deal with memories and flashbacks, how to work through forgiveness, how to have where it feels like my body is not going to lose control. How am I going to deal with panic and anxiety and the depths of despair, of depression? All those things have to be addressed. So that's why I say it's a time not to do this alone, but it's a time to really seek the right kind of professional support. All right. I also have on aplaceofhope.com, aplaceofhope.com, go to the tab that says test and be sure to take the trauma test. And this is a test that is confidential, kind of give you a score, but it'll help you see all the different symptoms and things that could be present. It's just a good place to start. And there is hope.